Hey, I'm Dr. Spencer Russell.
And I'm Dr. Alex McRee, and we're here with JAX Implants to talk about full mouth implants, what you should know, and cost.
Yeah, we know there's a lot of different options out there and things can get quite confusing. So today we're going to break it down into what the different options are, what may be right for individual patients, and then we'll actually go into the cost of each of the different treatment alternatives.
And we put out a similar video, I'd say about 3 years ago, a few gray hairs ago, and it's pretty similar, but there's a few updates in here, so we felt like it was appropriate to kind of give some updated information on, hey, this is a little bit different, this is a little bit different, so you can be the most educated on what is the state of the art and the most up-to-date thing. I'll jump into it. The main three things that we'll talk about today are full mouth implants, which, all in four, teeth in a day, there's a bunch of different terms. Snap-in dentures, which are dentures basically that just attach to implants, and then just regular dentures. We'll start with full mouth implants because that's probably why you're watching this. And so we'll kind of describe what that means, how you do it, what's the long term, the cost, everything. So that way you can be educated on every bit of information that you may need to know to ask your doctor or your healthcare provider, your dentist, whatever it might be, on what's right for you or what's not right for you. Okay, so full mouth implants. I would say the biggest thing, the most confusing thing, is there are so many names for it. So Dr. Russell, give me a list that what people might see that all are kind of meaning the same thing.
Yeah, I mean, you're gonna see out there all on 4, all on X, teeth in a day, Teeth Express, 3 on 6, ours is the Dreamline, tons of different names out there. It all basically means the same thing, different trademark names and whatnot, but all indicating full mouth implants.
And so what are full mouth implants? So say all on 4, what is that?
Yeah, so the name all on 4 came from, the traditional way of doing things is placing 4 implants to replace a full set of teeth. So as you can see in our model here, we've got a full set of upper teeth from molar to molar, and then on the underside, we've got areas where it connects into the implants. So what this is gonna do is it's gonna screw in and attach to the implants, stay secured into your mouth, it's not gonna come in and out, and it's gonna replace an entire set of teeth.
Yeah, so, okay, so all on 4, so basically it's a bridge, right? So you don't need to replace every single tooth with one single implant, which is a common question that we get. I would say another big thing that I know it seems basic for us because we're dentists and this is what we do, does this come in and out?
No, so this is gonna stay screwed in. It can come in and out if we or your dentist was able unscrewed it and took it out, but for you at home, it's gonna stay screwed into place. You're gonna treat it just like your natural teeth. You're gonna brush it, you're gonna water pick underneath it. You're not gonna take it out at night.
How much is my chewing power gonna be compared to like when I was, 17 and had all my teeth?
Yeah, implants are gonna get you back to that 98% plus % of your chewing power. So back when you had all of your teeth, able to eat anything you want, this is the only thing that's gonna get you there.
And we'll touch on more like what the differences are, and we'll reference that between what snap-ins and dentures are. I would say that's the largest difference. Obviously aesthetics are gonna be beautiful with this, but really you can make a denture look pretty good. But that's the biggest key. All right, so I get this question a lot too at consults and say, hey, well, okay, do I need to already have my teeth out? Like, do you do extractions? Or who does the extractions? Do I do the implants the same day? Do the teeth go on that day? How do I do this? Because you're saying, okay, I get to that, but I have teeth now or don't have teeth, or I have dentures, or I know someone with dentures, but like, how do I get to that?
Yeah, and so this is going into really the big reason why we say if you're gonna have a procedure like this done, you wanna do it somewhere where they're doing this all day, every day, because we're able to handle it any way you come in. So if you have teeth, if you're already missing teeth, if you don't have any teeth, you're already in a denture, we're able to place those implants for you and get you teeth that very same day or the next day, depending on how you wanna schedule it.
Okay, so I could come in without teeth or with teeth and then leave that same day with that?
Yes, exactly.
Now, am I gonna get my final teeth?
You're not gonna get your final teeth that day. You can if you wanted to, but really, and we'll kind of dive into why you would or wouldn't wanna do something like that. But traditionally what we're gonna do is we're gonna place the implants and then we're gonna 3D print a temporary for you. It's gonna look very, very similar to your finals. We want you to get an idea of what are my permanent teeth gonna look like, but it allows us to get you something very quickly and something that we're able to make quick changes to as well. So if you said, hey, I wanna make these teeth a little bit longer, that don't necessarily like the way this looks, very quick for us to make those changes. And then the big reason is after surgery, you're gonna get some swelling. You're gonna have, over time, that swelling's gonna go down. Your gums may change a little bit. So we're gonna let things heal for a few months before we go into those permanents.
So it's not, so you can do straight to final. It's just probably wouldn't in...
Yeah, so this is something we're hearing more and more of now. You'll see different places, corporate chains that are saying like, hey, we're gonna go straight to your finals. 24 hours, you're gonna be in your permanent teeth, or 1 week, 2 week, whatever that may be. So you're hearing that more and more. So we have the capability to do it. I think we have the capability to do it faster than probably anybody else out there.
We've done one same day, but yeah. I go back, piggybacking off what he said, I just don't recommend it. It's just not a long term. I wouldn't do it for me. I wouldn't do it for my family member.
I was gonna say, if it was your mom, how would you do it?
I would wait. And the funny part is they talk about finals, and I know we're getting a little off track here, but it's a big thing. It's in marketing. You hear about it, so it's worth talking about. Is that they say, all right, you get your finals, but it doesn't really help because we're waiting on the implants to integrate, right? So we wait, 2 or 3 months for those implants to integrate. The teeth are not the limiting factor. The implants are. Very similar, we use this analogy a lot, is that when you get a hip implant, right, you don't go running first day. You can walk, just like when you get your surgery and get your teeth done for an all-on-4 or teeth and day, whatever you want to call it, you can start eating soft foods immediately, just not hard foods. So you're kind of walking in your mouth, right? So you're not going to go running. So even if you did your final teeth day 1, you still have to be on soft foods. So there's really no advantage. And people think that it's like some huge savings in time, but it's not. And now you have a gap for the rest of your life. And it's just, yeah, it sounds great in marketing. I just wouldn't recommend it. So, take that for what it's worth. So, okay, so this is, I would say, the bigger difference of our previous video, which you can go watch, we think it was pretty nice, is I see Dreamline, I see Dreamline Plus, you're talking about titanium, you're talking about a long-term temp, there's zirconia, there's PMMA, I'm seeing all these materials. We'll even touch a little bit on, I see acrylic denture teeth, but they call this hybrid. There's this nano ceramic. What do I want? And what would be a question I would want to ask my dentist and say, why is this the best, or what is this the best fit for me? And so, if I'm a patient, explain to me the different options and materials and what's best.
Okay, yeah, so we've got a few different major materials here that I would like to go over. The main ones that you're gonna see out there is gonna be zirconia, and then you may have zirconia on top of a titanium bar, and then you have a 3D printed temp or something milled out of a PMMA-like material. So if you're having this procedure done and you're talking about your permanent materials, the thing you definitely want to have in your permanent material is zirconia, for sure. So whether that is monolithic zirconia, all one piece, where that is just 100% zirconia all the way through, or it is zirconia on top of a titanium bar. If I was having this procedure done and I was getting my permanent teeth, I would want one of these two options. We also have something that you were talking about, the long-term temporary option. So we'll do this sometimes, and so this is gonna be the same titanium bar that we have in the permanent, very same exact process. The only difference is gonna be what's on top of it.
And so this is actually not, you may be looking at home and you say, well, okay, well these look kind of the same. This is actually a temporary material, and this is the final material. You would know if you were holding it. This is much, much heavier, but looks-wise is great. So you're like, okay, but well, why do I want something heavy? This is a little more porous. I would think this is more like Tupperware. It's still strong, but it's not like glass. So think of like when you put spaghetti sauce in glass or Tupperware, right? You go wash it, but you can tell. So over time, a temporary is a little more porous. Even though you're brushing and doing everything to keep it clean, it's gonna stain. It's a little bit weaker, but it looks fantastic at the beginning. And so that's why we go to this material, because it is stronger, so you can eat the hard foods, and can also prevent staining if you're a smoker or a wine drinker, and it's just really gonna help. You may want this if you're a grinder, if you're traveling out of state. We have a lot of that here, but you may be traveling somewhere that you found someone that you really like to do that, and that just adds a little bit more security just in the temporary phase, so you're not out of town, or maybe even during your healing, you're gonna take a trip, you're gonna go on a cruise, and so you might ask your provider, say, hey, is it possible to put the titanium bar within my temporary, so hey, while I'm out of town, I'm not gonna eat hard foods, but I accidentally did something, and then now I'm on a cruise and I've got my teeth are broken, and now I'm kind of in a bind. So that's just something to make note of.
And one of the other things I want to mention on this too is you're starting to see more and more of this where people are coming in and advertising this procedure, and you see a really low cost. And so one of the main things I would be looking into if you see that, you know, somebody may be saying it's $12,000 and they're claiming it's a permanent option. And this is when I would really want to go and ask them, what materials are you using? Because a lot of times what you're going to see is they're putting a titanium bar in here. Usually, some of them aren't. They should be at the very minimum. But then they're putting this printed or PMMA material on top of it. And I would not consider this a permanent solution. It used to be something that you can consider a permanent, but we have much better materials now, something that's going to last much longer for those reasons that Dr. McRee mentioned.
And so you have to be a little bit cautious for the wording. They're like fixed, permanent, but not final, and they'll get tricky with the wording. And it sounds like we've just seen it a lot. And so you do have to do some research on, like, you know, I'm not saying that, you know, we're, you know, the final word on everything, but I do know a lot about this. And I see it, and it's a little unfortunate because we have had patients come in here that say, "Oh, I got my final," and I'm like, "That's not a final," and now it's broken. And then what? No, and then the last guy said it was a final. So just ask, and I'm not saying everyone's doing that by any means. And so just be aware though. If they're saying zirconia, if they're saying titanium bar with zirconia, they're probably talking about a final. And so you're getting, someone's being straight up with you, and so that's a good sign.
Yeah, if they're not mentioning zirconia, there's probably a reason, and you know, I probably wouldn't want that as an option. A lot of different materials have come and gone over the years. We've heard Crystal Ultra and different nano ceramics that they talked about. Oh, this is going to replace zirconia. At the end of the day, those materials have worn, they've chipped, they've broken, and so zirconia has kind of been the tried and true option, and it's really the gold standard.
I personally used Crystal Ultra, I would say about 5 years ago. The manufacturer led us a little bit astray. That was not as strong a material as I was led to, or a lot of people were led to believe. I did replace those with zirconia, and again, going back to, if it was myself, it was my family, zirconia is the winner. I mean, and it's not really particularly close.
And that's not to say there's not a material that'll come out in the future that will replace zirconia, but for the time being, this is still the best we have. So to dive into a little bit now between, you know, the zirconia versus having titanium inside it. So, you know, there's places that'll tell you, oh, having titanium, it's always going to be better. Or, you know, only having zirconia, it's always going to be better. And you know, that's not the case. It's like a lot of different things out there. There's pros and cons to different ways of doing things. Really what I break it down for our patients is that the best thing about the monolithic zirconia is that it is incredibly hard and incredibly smooth. And so just like Dr. McRee was talking about earlier, with this more porous temporary material, trapping stuff, staining, stuff like that, zirconia is the most resistant option we have to that. And so it's not going to stain over time. Really, the color, the shade that this goes in at, it's going to be the exact same 5-10 years down the road. The other nice thing is this underside. It's so incredibly smooth. It's like a glass-like finish here, and nothing sticks to it. And so as long as you're doing what you should at home, cleaning it with a water pick, it's going to stay like that. I've had these in patients' mouths for years and years, and sometimes we've taken them out, and it literally looks exactly like this when you take it out. So that's really the biggest benefit to having that zirconia there.
And so switching gears just a little bit, another massive question I get is, you know, obviously we've went over what it is, how you do it, what the materials are, what you should ask. So many people ask, oh, I was so worried I didn't have enough bone. And we have a couple other videos talking about that, but I do want to touch on it because it's very important for this particular thing. Pretty much I can just go ahead and tell you, you probably do. I mean, 99%, if not higher, have enough bone. And if you went to someone that says you didn't, go to somebody else too. It is possible, I suppose, but we do it with people who have diabetes, smokers, postmenopausal, osteoporosis, and it just works. And so I don't want people to get dejected or depressed because they went somewhere and and they think it's not possible, it probably is. And I'm not saying come here, or you could, but
I was gonna say, I mean, how many times have you personally seen people that they've gone to a dentist somewhere else and they've told them, oh, you don't have enough bone, and then they come and see us? And
so just know you probably do. And so just go see wherever you are, or you can call us, but wherever you are, there's probably someone in town that does this. There's all sorts of different implants that you can do, zygomatics and pterygoids, and again, we have a video that goes on more of that, but just suffice to say, you do. And so don't give up on that. Just because someone you said, and that'd be like me talking about root canals, right? That's not what we do. This is what we do. So if you said, hey, what's the latest on root canals? Don't ask me. I don't know, because this is what I do. And so you might go to your local dentist or someone who's not super knowledgeable about it, and they're like, no, you don't have enough bone. And I'm not judging them. This just isn't what they do, so they just don't know. So ask around. You'll probably be all right. And so I see you got a couple different things over here. So you talked about the zirconia, you talked about the titanium, and this one looks a little skinnier over here. Do that in every case, or?
Yeah, so this one is what we call an FP1 style bridge. And so as you can see here, the major difference is you're seeing just the teeth here versus the teeth and the gums. And so this isn't something that we recommend for every single patient. Honestly, for the vast majority of our patients, this is not the best option.
Well, and so in my opinion, it sounds simpler. But it's actually more technique sensitive. And so the biggest issue with that, or not issue, I mean, they're great when we can do them, or when someone wants them, or whatever it might be, or has a high smile line like myself, is that everything has to just be just right there. So you have to follow where the gums are, and so and where it's easier to, an artist can paint them beautifully, and you nail it 10 times out of 10 every single time. Whereas that one, if you've been missing teeth, more than likely your gums aren't exactly even, so it's hard to make the gums go back to even. Or you're missing bone in certain areas, your sinuses are low, which doesn't mean that we can't do implants. We certainly can and do them very well. It just may not be that style. So still a great style. Still would ask about it. Your local dentist to say, hey, am I a candidate for that style? It's the same price and everything else, but just be aware that, hey, it's not for everybody, but hey, ask about it.
Yeah, I would say the most common thing that we see there is, somebody's missing some teeth and you have this big dip in your gums where your gums are receded. And you can kind of imagine if that was sitting there, it would have this big gap there and it just wouldn't look right. So very, very select cases, and then a little bit more work involved, making sure that you're gonna have a really good outcome. But in those scenarios, very, very good option for people.
Okay, so I would say this is the biggest thing, and then we'll jump to the snap-in dentures, and the dentures is cost, right? And everyone wants to know that, and we always post our prices on our website. And some others do too, but a lot of people don't. A lot of people will be, we're one place that does it all in one spot, and there's a lot of other places that do that too. I would recommend something like that if that's available in your town or area. But sometimes you have a general dentist and they'll refer to a surgeon to do it. And so it's very difficult because you're like, well, I'm trying to get a price here, and then they got to talk with the lab, and then I'm trying to get a price here. And it just feels like smoke and mirrors, and it's really annoying. If I'm being honest, if I look for a car or something, they won't give me a price online, I just don't even call. And so honestly, that just annoyed us, so I'm just not gonna do that. So we post it on our website. And so I would say national average is somewhere between 15 to 25K. I mean, I've saw someone today that was 80K for upper and lower. So usually people say it's per arch, and that's for a top or a bottom. So double arch or full mouth would be the top and the bottom. So 80K is exorbitant.
Really high. Not the highest we've heard, but still really high.
And so just know that we're usually on the lower end of that, depending, if you need pterygoids or zygomas or something like that. But usually everything we do is in one package, and most places are too. So it's not per extraction. It's just, hey, this is the price, and that includes everything. Temp changes the whole deal. And sometimes we'll break it up, right, to where it's hey, you're just paying for the surgery or the temporary because you're not going to the final yet. And in that case, sometimes we'll do what's called a long-term temporary, and your provider might do that too, because you're hey, look, I'm in a bad spot, I've got broken teeth or I've got infection or whatever, but I can't quite get to that final zirconia and like, I just need to get into something. Okay, maybe that's a great fit for you. And so this is not gonna last you forever, but that way you can get your surgery done, you can get healthy, and you're like, hey, I know I'm working towards that. So just know that that is an option, at least at some places. I know here, but I don't want to speak for everyone.
Yeah, we've had patients be in something like this for 2 to 3 years until they save up and they're ready to move into that permanent material, and it works really great for them, have that nice smile, able to eat, and live their life.
But again, I say 15 to 24 is just seems 15 to 25, something like that is going to be I'd rather just come out with it. Again, check out our website, which we'll list down below, if you want to see what our latest thing is, and so that way you can know. I'm not diagnosing you, I don't know what you need, but if this is what you need, you're like, look, I don't have to beat around the bush, I already know what it is, and I know if I come in there, it's not gonna change. And which is, I don't know, this is the way I'd wanna do it, so that's the way we do it. And it doesn't mean that's all up front. I do wanna, and that's not just us. Again, most places have financing, whether they be third party, in-house, or whatever, or they check with their local bank. So just know that that might be a shocking figure. If you haven't shopped around, it might be a low figure if you've shopped around and found some really high places or what your quote was. So I don't know, what your perspective is, but just know that there's plenty of options and places will work with you. Like I said, we'll try and extend the temporary time, whatever it might be.
Well, and just like you were saying, it's bringing in the car analogy. Most people aren't going to the Ford dealership and dropping down $30,000, $40,000, $50,000 all at once. Most people are financing these things, and it becomes a much more affordable option when you're talking about splitting that payment up over X amount of months.
So in conclusion, all-on-4 full mouth implants, you can get the implants immediately, you can get the teeth immediately. The chewing force is dang near close to 100%. The aesthetics will be absolutely beautiful. You can check it out on our website, our before and afters. If you see that, they're all those implants. And again, it doesn't mean you're coming to us, but just so you can check those out, just be like, okay, what does something like that look like? Does it look natural? Does it look fake? It doesn't, if it's done well, and a lot of other places do. So basically, it's the closest thing you can get back to where your natural teeth were. So next up, we won't spend as much time because more than likely you're talking about the full mouth implants. That seems what most people want, but we'll go into snap-in dentures. If I'm being honest, these have kind of fallen out of favor just because like a long-term temporary or provisional is similar in cost and honestly is better because it's fixed and doesn't come in and out. But a snap-in denture is something that comes in and out. Still similar surgery, still the implants are going into the jawbone and then later on make the denture and snap them in. The advantages is it can be less in cost. Well, with the caveat of this is probably similar to the long-term temporary, and that the healing period is pretty bad because you cannot, like with this, you can hook the implants on immediately. And you're like, well, wait, why can I hook the implants on immediately here, but I can't here? It's because here they're rigidly fixated. So like a suspension bridge, they use each other for support, whereas these, they're kind of all out on their own. And so each little snap, it's like a snap on like your jacket or your jeans or something. They're kind of each individual and they're not braced together, so you have to wait for them to integrate, kind of like we're going back to that, running versus walking or the hip implant. At 3 months they're integrated, so then we can snap them in, at like the 4 or 5 month mark once we've got the denture made. Those 4 or 5 months are not great, I'm gonna be honest with you. And that's not just us, that's just a denture that's on a healing ridge. I mean, if you think about it, it's like, if you had elbow surgery, what's the last thing you'd wanna do? Put something that rubs on it? I mean, it's
what I tell patients all the time is imagine you burned your foot really badly, or you had a really bad cut on the bottom of your foot, and then I asked you to walk around barefoot on gravel all day. Like it's not going to feel good. It's going to be rubbing up against it. It's going to take much longer to heal. It's just not going to be a fun process.
But I will say this. So for typically someone coming from teeth, even if they're not great teeth, it just doesn't like them. They get to the end, and even though we've made it absolutely perfectly, they're like, wait, this is it? I'm like, that's it. And I'm be honest, it doesn't feel great as a provider because it still does have some costs associated with it, but it's like trying to make a bicycle car. It doesn't matter how good you make it, it's just not a car. And so the only people that seem to be happy with it are
Yeah, are going to be people who already have dentures. And so that's really the only time I recommend this, is if you're already in a lower denture because you know how terrible they are. If any of you out there are watching this and you currently have a denture, you know exactly what I'm talking about. They don't stay in place, they flop around, they're flying out of your mouth. Even when you put adhesive in there, it wears out and they're still moving. Now, if you've come from that and you go into this, you're like, oh my God, this is great. They don't fall out of my mouth, they stay in place. But they're called, a lot of people call them the snap-in denture. Since they can snap in, they snap right back out. And so what you tend to find is, you bite down hard on one side, you're chewing, and it pops up on the other side. Or you try and bite into something hard like an apple, and it levers that front and the back end pops up. And even if they're not fully coming out, they're just moving around, and it's very difficult for you to be eating these foods you want and really enjoy them.
I would say the chewing power is more like 50%. And when I say 50%, that doesn't mean you like, oh, I'll just chew a little longer. No, like 50% of the foods you can't eat. I mean, I guess technically you can eat, but it's not fun. So I don't want to misconstrue that, because people have said that before. They're like, oh, 50%, that's fine, that's not bad. Well, maybe I'm saying it wrong, or what I'm trying to infer is that it's pretty low. And so with that, like I said, it works well on the lower. If you have dentures on the lower, you're gonna see an improvement, and honestly, those people are happy with it. And you notice we kept saying lower, didn't really say upper. Why?
Yeah, so we don't really recommend doing the snap-ins on the upper ever. And there are places out there that'll do them, but a lot more studies are coming out nowadays, long-term studies that are showing these snap-ins on the upper just don't last. And going back into different kinds of analogies, it's like having these fence posts in the ground, and each one is individual, and you can go in there and just wiggle that implant individually because it's not rigidly fixated with something to support all of them together. And so what tends to happen, and it's not going to be year one, it may not even be year 2, 3, 4, but 5, 6, 7, 10 years down the road, those implants, they've been wiggling and wiggling, and you slowly start to lose bone around them. And then next thing you know, all these implants are loose, and now you can't wear your denture anymore. And so that's one of the more common things we're seeing from these patients who've had snap-in dentures done elsewhere. They're coming back and they've got these failing dentures. And the big problem is they had these implants on top, they lost a lot of bone around them, and now to replace them is going to be a little bit more difficult as well.
Yeah, and we, again, going back to it, you have hope. Don't fret if that's the case. But yeah, it's a little bit more advanced, and maybe doing those, like I said, the zygomas and the pterowoods and things I'm talking about. But again, you can, not just with us, there are people that can fix that. So if you are in that situation, don't worry about it. It doesn't matter, like you got some life out of those snap-ins. I hope it was well for you, but probably gonna go with this option going forward. And then jump into cost on snap-in dentures. Probably, it depends like on extractions and how many implants we're doing, all that stuff. But I would say 10 to 14, which again is probably putting you right in the long-term transitional, which is why we don't really do them anymore, just because for the same dollar amount, this gets way more patient satisfaction. So, I mean, just why not? And then we have the lab here, or a lot of places do. So that's probably what I would ask about. If it were my mouth and I'm spending around that kind of money, I'm gonna do this 10 times out of 10.
Then our last option here is just going to be your traditional denture. And so this isn't anything that's supported by implants. As you can see here, it's just one piece that's going to be an upper denture. Upper dentures work well for a lot of patients.
And they look nice.
They can look very nice, very similar to how any of the other options are going to look. But the biggest downside, you can see this big hunk of material here. It's going to cover the roof of your mouth, and that's how it works. It covers the roof of your mouth. You get good suction out of it. It stays in place. But you've got this giant piece of acrylic covering the roof of your mouth. So it's gonna change the way you talk, it's gonna change the way you taste things. You can't, a lot of people don't know this, but you do have taste buds on the roof of your mouth. And that's a huge complaint we hear from people in upper dentures, that I just can't taste my food. It all tastes bland now. And so what we tell people is if you're looking for a low cost alternative that's still gonna look good, you can go out, you need to talk to people, see people, things like that, this is gonna work well. But chewing power wise, we've said the full mouth implants, you're gonna be at 98%, the snap-in dentures, you're gonna be at 50%. Traditional denture, you're gonna be more in that 10 to 20% range. And so that just, again, it means not that it's gonna take you 4 or 5 times longer to chew things, that means 80% of the foods that you want to eat, you're just not going to be able to eat them. You're not going to be able to chew corn on the cob. You're not going to be able to bite into an apple.
I do that. Well, most people.
Yeah.
I have had patients come in and say, I eat corn on the cob and they don't even have a denture, they just have gums.
Yeah.
I don't understand it. But so when we say this is averages, and I've also had patients that are missing 1 second molar and say, oh, I can't eat anything anymore. So I don't know.
Just because your aunt said she can eat whatever steak and apple she wants with her dentures doesn't mean that's how it's going to be for you.
But maybe she can.
Yeah.
So, and maybe you can too. I don't know. But
for most people, that's how it's going to be. And so again, great lower cost alternative for people, but just not going to give you that same security. And then again, you're going to have to take it in and out, clean it, and that's a deal breaker for a lot of people. Or if you have a really bad gag reflex, we've seen that a lot. You're definitely not going to be able to wear this because you can imagine that going back there going to cause you all kinds of problems.
And you can lose it, you can break it, you do have to replace them, etc. So because the bone does remodel over time and they won't last you forever. But going into cost, again, that's what most people want to know. I would say from 1,000 to some places make very cheap dentures, which I'm not trying to judge that. They are, and up to 5 to 7, depending if there's a bunch of extractions or maybe they have to do alveoplasty, which that means kind of contouring the bone a little bit because there was some unevenness and you got to make it fit the denture better, and also got to make maybe a premium set of denture. And when I say premium, I'm not saying that it just means maybe the material's a little better or it's a little stronger or something like that. And you can ask your provider what the differences are, but they're still all the same acrylic. But yeah, you're going to be from 1 to 7, which I know it's a wide range, but that's just most of them are not all inclusive. They charge for extractions, and I just don't know what you specifically have, but that at least gives you a ballpark on what that's going to be to get you in a set of dentures. So that's kind of all the information that we've got, at least the most up-to-date stuff that we got for full mouth implants, snap-in dentures. We've got a bunch more videos.
Yeah, on our YouTube channel, if you want to look at that, we've got stuff that goes into the more complex cases, how to keep these things clean, different options, stuff like that. So just check out the channel, go through those, and then if you have any other questions, just leave us a comment. We'd be happy to answer them in the next video.
So I'm Dr. Alex McRee.
I'm Dr. Spencer Russell.
This is JAX Implants, and now you know about full mouth dental implants.